According to the American Academy of Orthopedic Surgeons, about 267,000 total knee replacements are performed each year in the U.S. To discuss the procedure, here's Dr. Douglas Roger of Desert Regional Medical Center in Palm Springs, who explains the continuing advancements.
We frequently see degenerative arthritis of the knee. This can result in very debilitating pain that can make it difficult to walk, difficult to ambulate in the community, difficult to even stand and perform activities of daily living. And these are the types of problems that frequently necessitate something major like a knee replacement. There have been some significant advances in surgical techniques for knee replacements. There's minimally invasive knee replacement surgery. There's muscle-sparing knee replacement surgery. We've been using a technique here for about the last 3 to 4 years that involves a pure muscle-sparing approach to the knee, where an entire knee replacement can be performed and not cut even one single muscle fiber. The advantage of that is that when you're done placing the knee replacement, the muscle can be placed back over the knee component and the patient can get up and walk immediately without the recuperation that has previously been necessary that resulted from the trauma of actually cutting the muscle in half. So traditionally, the muscle was cut in half, the quadricep muscle, for instance, right down the middle, whereas nowadays with a muscle-sparing approach, there are actually methods of doing a complete knee replacement and not cut even a single muscle fiber, which is an astonishing thing in a way if you think about it, because it was unheard of several decades ago. But now when people get up from knee replacement surgery with that kind of approach, they can usually walk immediately. We've had some people go home from the hospital within 24 hours after a knee replacement surgery, walking on their own with no help. Most people can get up and walk around easily within 2 to 3 days and put full weight on the knee and walk around after that. So there have been really some tremendous advances in the surgical technique for doing knee replacements. The general principle of knee replacements, to use that as an example, is a component that is made of part metal and part plastic. Now, traditionally, it's been the plastic that wears out over time. When a knee replacement wears out after 8, 10, 15, or 20 years, it's usually the plastic part of it that has worn down and it requires a new piece of plastic. But there have also been improvements on the metal side. In the early days when they made knee replacements, they were made of what we would now consider to be primitive kinds of metal. They were not very strong. They did not wear very well on the plastic. Whereas nowadays we have things like polished cobalt chromium, which wears very well on the plastic component, and there's other metals that are routinely used like titanium that have tremendous strength, but also the flexibility to distribute the stress of the knee replacement over a diffuse area of bone. So there have been significant advantages and tremendous progress made in terms of the materials that are used in knee replacements. Success factor for knee surgery by and large is very high, but any smart surgeon will never get too cocky because something can always go wrong that you never thought of before, and that can happen. But for major knee surgery, the success rate is around 98%. It partly depends how you define success. Certainly if you had a major complication, that would be an unsuccessful category. But by and large, major reconstructive knee surgery like knee replacement surgery is successful about 98% of the time.